Welcome to Forum 360 with a global outlet and a local view. I'm Ardith Keck, your host. My guest is recently retired as president of the American Public Health Association. So we're going to be talking health and how the public perceives health in the United States. Welcome to Tom Quade, now Health Commissioner of Geauga County in Ohio. With his background, Tom has views on public health and the state of health in the nation. So we have lots of questions which I know he will be able to answer. So Tom, thanks for coming today.
Thank you very much.
It's an honor to have you here. What is public health?
Public health is a very broadly defined, well, it's sort of, I'll break into three categories, right? We have the practice of public health, which is what I do most of the time, right? That's those of us who are in governmental public health are typically seen as the practitioners of public health, though that goes far beyond local health departments in terms of what public health is. We have the science and the academic field of public health that are preparing the workforce and doing all the research that guides us and informs us, so we have best practice in public health. But we also have public health as an outcome or a status, a state, if you will, right? So a population's health is described as the public health. What is the health of the public? Shaped by policy, shaped by funding, shaped by partnerships, it's shaped by so many things. So public health is really about as broadly, can be as broadly defined as your imagination will allow.
Okay, is it different from doctors treating people, treating our health?
Indeed it is. The doctors are, if you think of a timeline, the doctors are the ones that come and repair. It's a critical piece of that continuum. Public health is really, if we do our job without any other influence, really, which we can't do because it's health is defined by public's actions and choices and behaviors and so forth. But in the best scenario, folks wouldn't need to go to a physician for treatment. They would ideally go to a physician for preventive care, for screenings, for things like that. But those are really the public health aspects of clinical health. Clinical health is really the focus on the individual, sometimes it's groups of individuals even in clinical health. Public health is population-based. While we pay attention to what happens to individuals within that population, the work we do, the policy we influence, the spheres that we try to move, those are all population-based. So it's entire groups of folks, whether it's a class of individuals, a population, a neighborhood, a city, a state, a nation, or the world. That's all public health.
You're a commissioner on a day-to-day basis, that's your job of health, which is health departments.
Yes.
Is public health only health departments?
Absolutely not. And that's one of the things that is really becoming much more part of our conversation when we talk about what public health does. Public health departments are really, they're a central hub in a community. They're often still that go-to place for public health information. We have a central focus in emergency preparedness and public health response to emergencies that impact public health. We do an awful lot of the regulatory piece, the things that folks oftentimes expect their health department to do, restaurant inspections, school inspections, body art, tattoos, piercings, things like that, pools and spas, septics, wells, all of that stuff happens at the health department where we're really trying to assure healthy people are living in healthy places under healthy circumstances. But the actual engagement of public health, the things that we're doing to protect, promote, and preserve the health of populations often requires us, and as it should, to engage other partners in the community. And increasingly, as we look at the true drivers of health as being well beyond the bugs, right? we recognize that our partners in the community have to be as diverse as public health is. So when we think about employment or education or workforce development or even responses to things like the opioid crisis, those all impact every sector of the public. And so while we may not be the key piece, we are certainly, if nothing else, the folks that should know enough to bring those players together and to facilitate those conversations and those strategies. And that's a little more complicated than some of the work we've done, in that sometimes we have to let go of our own language and our own agendas to bring those partners into the fold and as part of the response. But that's kind of the exciting part of public health for me anyway.
So do you work with doctors and hospitals and groups like
we
that?
We often work with doctors and hospitals. Increasingly, hospitals are now focused more on what they will call population health, and it's inching towards what we would call population health, but with different drivers, some of it being cost control and things like that, in terms of keeping down the numbers of folks that are readmitted to hospitals. Certainly with physicians that are treating patients, having an increased focus on prevention and assuring that folks are getting screened for different diseases or things when they need to be screened. So we have those partnerships. We're certainly trying in public health to increase access to medical care. That's on a policy level. Public health or practitioners or advocates of increasing access to care have been for decades. And so in those regards, we are working very closely with hospitals and clinical care providers. We also have, but again, the partnerships that are growing, one of our strongest partners when I was the health commissioner down in Marion, which is up until a month ago, was our local Chamber of Commerce. Now that's a group that I normally had not contemplated as being a strong partner in public health. But when we try to advance our agenda in the community, in whether it's the folks that are sitting on city council or the folks that are making hiring decisions or policy decisions in the workplace, it means so much more when they're hearing the voice of our local Chamber of Commerce than necessarily the health department sharing our ideas with them, right? Because different folks have different audiences. They have different folks that inform the work they do. So it's really trying to bring in those new partners in creative ways.
It sounds like you're working with everyone.
We are working with everyone. I honestly, if somebody had said, "Who aren't you working with?" If I could come up with an answer, by the end of the week, I'd probably be working with them. So, yeah, again, if we define public health and the things that drive health increasingly as non-medical, they are social determinants, drivers, impactors, facilitators, whatever language you want to use. But we're not; those are outside of our wheelhouse. We're not the folks that are making policy with regard to academic success or job readiness or employment, or we're the folks that are trying to make sure that when those decisions are made, they're done in a way that facilitates a healthy life. Whether it's an employer that is able to offer insurance or is sensitive to what shifts have different consequences on a parent or guardian being home with a child and the impact of that on that child's success socially, academically, et cetera. Everything is so intertwined, and I'm not suggesting by any stretch that health is the ultimate goal or marker or metric for success. For me, it's the path that I've traveled, and that's the one that I'm trying to move. But in order to move that metric, everything else has to move as well.
Interesting. Is public health evolving?
Absolutely, absolutely. Before I got into public health, considerably before I got into public health, it was focused on germ theory, right? I mean, this is the Public Health 101, wash your hands. If you don't do anything else, if you engage in every other risk behavior out there, wash your hands before and after you do it, right? that's part and parcel of why we don't have the outbreaks that we used to have all of the time. That immunology, vaccinology, all of the science that went into vaccine preventable diseases has allowed for, I was going to say forced, but is it allowed for an evolution beyond the vaccine preventable diseases? Although unfortunately we're back into needing to prove ourselves there for some folks, and because again we don't operate on an island. When one group of folks doesn't get vaccinated, then we put at risk those that either can't be or are unable to be for other reasons. But we've gone beyond a lot of that, and we're really focused increasingly on issues that really fall under the umbrella of access, whether it's access to care when we become sick, or it's access to those things that allow us to and promote health, to be healthy and to promote health. Things like healthy, affordable food, access to opportunities to engage in physical activity and not be as sedentary, access to safe housing, healthy housing, access to education, access to well-paying jobs. Those are all things that promote health. And as we recognize that it's one thing for us to educate the public to eat better and to move more and to and do all of these things, if they don't have those options on their menu, they can't select those options off their menu, because I use the analogy sometimes of the old drop-down menus on your computer screen, right? And those that were available to you were a different shade than those that weren't available to you. Now, we're very fortunate. Most everything that's on our menu is available to us, or some version of it's available to us. But there are the vast majority of people in our country, and 99.9% of the population of the world, who don't even have that menu item. When we talk about access to clean water, when we talk about access to toilet facilities, when we talk about access to clean food, when we talk about access to a safe and secure environment, when we talk about access to freedom from the stressors of any of the agonies that are out there, right? Then we can make those choices and we can do those things, but we're not doing a darn thing for the folks that can't have access to healthy food if we just say eat better. We're not doing anything for the health of somebody who doesn't have access to clean water by telling them to drink more clean water, or to increase hygiene that's dependent upon clean water. So that's really why we've gone upstream in the practice of public health, and that's really where that evolution of public health is.
Interesting. Okay.
Never a dull moment.
True. We're talking today with Tom Quade, who is the health commissioner now for Geauga County in Ohio, and he is the recently retired president of the American Public Health Association. So we're talking public health. Does that mean that public health is getting more money to to fund all these programs that you're responsible for?
No. One of the challenges is as we expand our view of public health, we're bringing in those other partners. So in some regards, we have access to greater resources through those partnerships. Those partners aren't getting additional funds to partner with us. And public health funding has constantly been, I don't say attacked, but has declined, has not, and certainly not kept up with prices of anything else. So whether that's adequate funding for a public health workforce, which if you're not competitive in the public health as an employer, you're not going to have the folks that you need to do the work that needs to be done. Public health funding for the folks that are in school trying to become public health professionals aren't getting the scholarships that they got. Public health funding for research is always a push-pull, robbing Peter to pay Paul kind of thing when we're dealing with research that impacts any of the medical fields. We tend to, as a society, invest much more in the technologies to keep people alive at times when they're critical than we do in preparing them to make the healthy choices that keep them healthy and will at least delay the need for those more expensive interventions. We don't make widgets in public health, so we can't sell widgets, so we can't deal with the prices of the market, right? We can't handle that market. When we do what we do very well, you don't see an outcome. When we do a fantastic job preventing communicable disease outbreaks, you don't see a communicable disease outbreak as often. When you don't have those, then you don't get the funding to maintain those. Ohio is a fantastic example when it comes to smoking. And once upon a time, we invested heavily in efforts to do cessation programming, to teach people how to quit, a lot of media into prevention, and so that folks don't start. We an awful lot of energy into the advocacy for legislation that had workplace smoking bans in Ohio. All of those things were tremendous successes, and we went from 25, 20 to 30% smoking rates in Ohio down to 16, 17, even lower percent smoking. And so everybody said, oh, smoking's done, right? We've solved this problem.
No money
Well,
there.
no, so that money dries up. And that money gets repurposed. It goes into something else that's also critical. I don't want to suggest that where it goes wasn't important, but when you stop investing in things that work, those things stop working. If my car got me here this morning because I invested in gas to put in my car to get me here. Well, I use up that gas, it's not going to get me home. So it doesn't really do any good. So that's constantly a threat. We don't do something that people see. Conversely, when we do have a major public health issue, whether it's Ebola, or it's H1N1 or something, we get this big influx, and because folks sort of hem and haw, and they say, okay, well, the numbers are now increased to a point where this is a crisis. So now we put in crisis dollars, right, great big dollars to do something, and gosh, we got to do it next week. So there's very little planning. So you got all these dollars, they come in, there's not very much planning, so you spend what you can spend. Sometimes there's a natural epidemic curve, that problem tends to go away. Then the funding drops out, and the funding drops out, the problem starts coming back, and they say, well, wait a minute, didn't we already fund that? So it's a constant battle, constant battle with funding.
What would you say is the biggest problem in public health that we have today besides funding?
Yeah. All right, so if we look at it in traditional public health speak, right, the actions, the decisions, the choices we make that impact our health, those really haven't changed that much. They were the same when I started into public health. It's physical inactivity, it's appropriate nutrition, a couple that we don't really talk about other than when it's one of their cousins, right, and that's substance abuse. We talk about it now when we're talking about heroin, primarily because it's of its impact in white suburbia, right? So we talk about it differently than we did when it was in the 70s and it wasn't in white suburbia. We approach it differently. Alcohol is a huge public health issue. It's the misuse of alcohol, primarily because it impacts the choices that we make, right? A lot of the unintentional injuries, a lot of the intentional injuries. You also have then just the physiological response to alcohol abuse, whether it's in your liver, your heart. That's still a leading cause. But then if you go upstream from that and say, well, why? Why is that an issue for some more so than others? And we then start to take a look at some of those stressors and some of those chronic stressors that we're really, that's sort of the next thing we're really sort of exploring in public health, is that ongoing chronic stress that populations feel. We start to think more of it when we talk about issues like opioid abuse and things like that as these diseases of despair, right? I think of them as really the responses to that chronic stress. So if you're an 18-year-old that has no prospect of getting a job because you didn't have the support you needed to get to have academic success and to learn the soft skills of getting a job, and that's been part of 2 or 3 generations, right? Then you don't have that hope, because we don't have the jobs that folks like that used to get.
Without the training.
Without the training, right? There's not that line job anymore. and it's very much a service industry. Well, then, you have a competing job market where you have folks that are trained, that do have a college education, maybe even a higher degree, and have some job training, but then the only jobs are available are in those service industries, and because they're not paying a livable wage, you're working 2 or 3 of them. So there's this constant stressor, and that's for those of us who are fortunate enough not to also have to deal with all of the other stressors that are imposed on us by society. Whether the other morning I was woken up by a knock on the door. It was about 7:15. Well, let me back up. It wasn't really a knock on the door. It sounded like a knock on the door. It was
okay.
the ice cube machine dropped a couple of ice cubes in the refrigerator, and in my brain, as I was waking up, it felt like the knock on the door. But I felt my blood pressure rise, right? At 7:15 in the morning, I don't live in a neighborhood where folks come knocking on the door at 7:15. Still kind of dark outside. But then I stopped and I thought, because I kind of can't get out of public health thinking, what if I lived in a neighborhood where there was gun violence? What if I lived in a neighborhood where there were constant stories of burglaries? What if I lived in a neighborhood where I can't walk down the street without feeling the stress of looking out of place in my neighborhood? Those are constant stressors, and they do have physiological as well as mental impacts on life, and those are things that drive a lot of unhealthy behaviors.
So your feeling is that stress and hopelessness are the biggest health problem?
Well, there's a lot more work being done on ACEs, on adverse childhood experiences, whether it's violence, whether it's neglect, any type of abuse, that children then grow up in those stressful environments. It could be food insecurity, it could be income insecurity, all of the familial stresses that go along with that. Those all have huge impacts on how we view our investment in ourselves. And if your ability to invest in your future is dependent upon your belief that you have the potential to achieve a certain future that's beyond where you are right now, if you don't think that that's there for you, where's the drive, right? Where's that eating well and exercising more could drop pretty far down on your priority list, right?
Absolutely.
So, we often forget that all of those basics are not available to everybody.
So what are the effects of unhealthy behavior?
Yeah.
If stress is high among your problems, what are the effects of other unhealthy behaviors?
Yeah. Well, ultimately, when we talk, to frame it in health as that status, that state that we're in, that comes back to the body, that comes back to your mind, it comes back to this vessel that we're in, right? I mean, the last day that you can be healthy is the last day that you're here, and then after that, who knows, right? But so up until that day, everything we do has an impact on the systems that we rely on, that we take for granted, whether it's our respiratory system, our circulatory system, our endocrine system, any of these systems that we take for granted that work. They're constantly assaulted by the circumstances that we find ourselves in at any given moment, right? Whether it's being on an airplane next to somebody who's coughing, or it's driving down a road where the person that's passing you is either under the influence or going to experience a road rage incident or whatever, right? I mean, there are all of these things, some of which we can control and some of which we can't. So when we do when we overeat, when we undermove, when we stop having that hope of that tomorrow may get me a little bit closer to where I want to be, or I can find peace where I am, whatever that means, all of those things will ultimately have an impact on what we decide to do. And even if it's where we are and those things that impact us, or the things we decide to do that impact us, whether you're smoking, you're drinking, you're overeating, you're undermoving, any of those things will ultimately, in and of themselves, I mean, they feel good, right? I mean, I like to sit down and have a full meal. Vegan or not, too much is too much, right? But ultimately, those things catch up with you, right? And at a societal level, it's a massive drain on resources. I mean, we spend so much on fixing those things that would have cost so little to have prevented, and that's been a truism for decades.
Is Ohio typical of, in terms of public health?
Unfortunately, yes. We're typical of those states that we used to say, well, gosh, at least we're not, and then name it. Unfortunately, they tended to be focused in Deep South. They tended to be focused in Appalachia. Essentially, again, we're dealing with high-stress environments, populations that don't have the same access to those things that make us healthy. Some of it's cultural, and the decision making. But you take somebody out of that environment and expose them to healthier options. Oftentimes, folks will embrace those healthier options if they have that opportunity. So I don't want to blame everything on the culture, but Deep South, Appalachia, and so forth, Ohio is starting to look like them. It's now the whole swath of the country.
Interesting.
Yeah.
I've learned some things, and I come from a health background, as you know, and I'm sure our audience has appreciated all the things you've talked about and probably learned a bunch of things as well. Thank you, Tom Quade. I appreciate your coming today. This is Ardith Keck for Forum 360, Global Outlook with a local view.
Forum 360 is brought to you by Electrical Impulse Communications, the John S. and James L. Knight Foundation, Hudson Community Television, the Rubber City Radio Group, an anonymous donor, the Jewish Community Board of Akron, Medical Mutual of Ohio, Blue Green, and Forum 360 supporters.